2, 1. Yes, welcome every single one of you. Once again, it's a weekend health talk. It's a weekend health talk. Welcome, 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 every single one of you. It's your host, Dr. Albert Sedon here, aimed at reducing the high level of misinformation, especially on social media, when it comes to medical issues, when it comes to health issues, and who are the best people to talk to us or educate us on health issues than the expert, the specialist in those particular specific fields. So today, once again, we have one who has become a consultant to this channel, a senior brother. He is like family now, and he's a regular on this channel. Please join me, specially introduce senior brother, senior colleague in the field, Dr. David Wilfred Parker Alote, senior gynecologist, to share with us on fibroids and ovarian cysts. Over to you, senior.
Thank you all. Thank you for this call, Dr. Albert. I don't know if you can see my screen.
Yeah, I can see it.
Okay, that's good. All right, I hope you can all see my screen, full screen. I hope you can see my screen. If you can see my screen, just type screen in the chat session. If you can see my screen, just type screen. Just type screen in the chat session so that I'm sure we can all see my screen. All right, that's good. Okay, that's great. That's great. All right, so thank you all. My name is Dr. Parker Alote. I'm an obstetrician gynecologist specialist, and I'm happy to talk about this very important topic of uterine fibroids and ovarian cysts. This is something that we see in a lot of ladies. At every gynecological consultation room, fibroids, ovarian cysts, infertility, they form a chunk of the problems that people present with. All right, so it's very important that we know about it. And there's a lot of myths about fibroids. So much myth. People believe so many things about what causes it, how to get rid of it, and so they end up doing so many things, and it gets worse before they present. Right, so it's very important that we all know about this very important topic and know what causes it and what we can do when we have it to be better. The problems that they give as well. I mean, what problems would you have if you have fibroids? What problems would you have if you have ovarian cysts? All right. What puts you at risk of getting fibroids? What puts you at risk of getting ovarian cysts? All right. So these are all very important things we all need to know. And how do you treat them? In fact, when you get them to, what are some of the symptoms that you would have? What would you feel that would make you know that you may probably have a fibroid, or you may probably have an ovarian cyst for which you would have to seek help. All right, and then how are they treated? So we'll try and go through this, and I'll try and break it down as basic as possible so that we all understand it very well, so we can also share with people. All right, so okay, so this is just something to show you what the uterus is. This is the uterus or the womb. This is how it looks like. All right, the womb is also called the uterus. All right, and you see where my cursor is. There's a hole inside the womb, that is where, when you get pregnant, that is where the baby grows, all right? So this is where the baby grows up there. This hole inside here, there's the space, that's where the baby grows up, all right? Now the rest of the womb, all this side where my cursor is, this side, that is the muzzle, all right? That is the muzzle of the womb, all right? The womb or the uterus has a very strong and thick muscle, all right, for it to be able to expand to about several times its size and be able to carry a baby. Okay, so it's a very powerful organ. All right. So fibroids can so this is another picture showing the womb again. All right. This, the whole, as I said, is where the baby grows. These are the tubes. All right. This is the ovary. All right. This is the cervix, and this down here is the vagina. Okay, so this is just how the womb looks like. Now, fibroids can form on any part of the womb. It can form inside the muzzle, all right? This is where the cursor is, that's inside the muzzle. Fibroids can form inside the muzzle. It can form outside the muzzle, so it will be on the surface of the womb, okay? Or it can form inside the womb, all right? It can be inside the womb where a baby would grow, or where your menses comes from. All right, so depending on where the fibroid is, you have different symptoms. Okay, you have different symptoms, especially assuming you have fibroid and it's inside the womb where the baby would grow. Of course, you can imagine the problems it will cause when you are pregnant. It will be competing with the baby for blood. All right, so you feel a lot of pain because more blood will go to the baby, and any cell in our body that doesn't get blood always causes pain. All right, it can make you get miscarriage, a lot of miscarriages. All right, or it can make you bleed a lot during your menses, and we'll come to all that. But I'm using this picture to show you so you understand it better. All right, or if in somewhere here, you can imagine to block the way into the tube. So there's no way sperms can go into the tube, so it will cause infertility. You'll be trying to get pregnant for so long and you will not be able to get pregnant. All right, so these are some of the problems that you would see as we go on. All right, so generally these are pictures of fibroids. Okay, these are pictures of fibroids. You can see that they are mostly round. They are round. So they are abnormal growth, okay, of the cells of the womb, the cells of the uterus. They begin to grow abnormally, and that is what we call fibroids. Okay, so when the cells are supposed to grow in a particular way, okay, they're supposed to divide in a particular way. Something, regulate the way they divide, so they don't begin to grow too much. They don't grow out of control. All right, when cells begin to grow out of control, then that becomes a problem. Okay, so when the cells of the womb begins to grow abnormally, then it leads to fibroids. Okay, but they are not cancer. Normally, when cells grow abnormally, that is where we get cancer from. That's the cause of cancer. Okay, but this time, the fibroids are not cancer. Okay, so they just grow abnormally. So you can see that this one here is growing inside the muscle. It's growing inside the muscle, so it will give specific problem. Now I can see that this one is growing, this one and this one is growing inside the hole, okay? We call it endometrial cavity, the hole where the baby would grow. You can see that this fibroid is inside there. This one too is inside there. So this one too will give specific problems. Assuming you are pregnant and the baby and the fibroid are all within the same hole, you can imagine the problems. So sometimes a woman comes to the clinic, she's pregnant and she has fibroid and she's always having a lot of pain. All right, she can have severe pain throughout the pregnancy because now the baby and the fibroids are competing for blood, and more blood is going to the baby. All right, so they get something called degeneration. The fibroid is not getting enough blood. Okay, or a woman has fibroid inside the womb, like in the hole, and so when she's having her menses, she'll bleed a lot. She'll bleed heavy with huge clots, bleeding for days, more than a week, 9 days, 10 days, and sometimes 2 weeks. They are bleeding with big heavy clots because the fibroid mostly It's inside where the menses comes from. So it causes them to bleed more. All right. So these are the different places that fibroids can be. All right. They can grow in any part of the abdomen. And depending on where they are growing, they'll give specific problem. And now 20 to 40% of women in the reproductive age have fibroids. Okay. So that's a huge percentage. All right. Let's say 40%. So out of every 10 women that you count, 44 of them may have fibroids. Out of every 10 women, 4 of them may have fibroids. So that's a very huge percentage. All right. And mostly fibroid affects only Black women. Hardly do white women get fibroid. It's not a disease for the Caucasians. It's mostly a disease for Black women of African descent. All right. So, and then the incidence rate is as much as 20 to 40%. A lot of ladies do not know they have fibroids. Because most of the fibroids don't give symptoms. All right. So most people are walking around, ladies, they have fibroid, but they have no idea because it's not giving them any problem. But maybe when they are doing a routine scan, something, and maybe somebody requests a scan for them, and the scan is being done, and then they'll see that they have fibroids as well. Okay, so that's a huge percentage. Now, what are the risk factors for fibroid? What puts a woman at risk of getting fibroids? Why would a particular woman have fibroids and another woman doesn't have fibroids? So these are what we call risk factors. So Black race, as I said earlier on, if you're a Black woman, you're at risk of getting fibroids. So far as a Black woman, a white woman is not at risk of getting fibroids. Okay. Nulliparity, that means a woman who hasn't given birth before, all right, carried a pregnancy to term. We call her nullip. She hasn't given birth before. So childbirth, pregnancy, and delivery protects you against fibroids. So a woman who hasn't given birth before is at more risk of getting fibroid. Obesity too is at risk. So obese women normally are also at risk of getting fibroids. Early menarche, when we say early menarche, it means a woman who started her menses very early, as early as 9 years, 10 years, they've started their menses, all right? Because they are exposed to estrogen for a longer period in their life, all right? The hormone which feeds fibroids and causes it to grow is the female hormone called estrogen, all right? So far as a woman, I see Ann Turnbull on the call. Ann Turnbull is a Caucasian, so she's not at risk of getting fibroid. And you're safe. All right. So a woman, the hormone that feeds the fibroids is estrogen. All right. So a woman who starts having her menses early in life is at more risk of getting fibroid because for a longer period, her body is exposed to estrogen, unlike a woman who gets her menses at 15 years or 17 years. All right. High fat diets also at risk. Family history, so if you have a close family relatives, mothers, sisters with fibroids, you are also at risk of getting fibroid. All right. So Black race, nulliparity, obesity, early menarche, late menopause, high fat diet. It's also a problem because most ladies in this part of the world are overweight and they get obese. People always have the feeling when you're overweight, it means you are healthy, you are eating well, you are living a good life, you are rich. Obesity comes with so many health challenges, especially when it comes to obstetrics and gynecology. Most things, obesity, you always say obesity, they're playing a big, big role. All right. So obesity is never a good thing. Now, what are the symptoms of fibroids? How would a woman know she has fibroids for her to present to the hospital? Now, most people with fibroids are asymptomatic. That means they do not have symptoms, all right? They don't have symptoms. They have the fibroid, they're walking around, everything is fine, all right? Majority are asymptomatic. Now, the symptoms that some may have is menorrhagia. Menorrhagia is heavy menses, all right? You are bleeding heavily. How do you know as a woman that your menses is heavy? One, you see a lot of big clots in your menses, all right? So if you are having your menses, you are seeing so much big clots, it means your menses is heavy. Two, there's something called flooding. If you are staining your clothes, even though you are wearing a pad, your clothes still get stained, it means you're bleeding heavier than usual. All right. 3, if you're changing your pad too many often, all right, too often, you're using within the period in the day, you have used more than 5 pads, then you're likely to be having menorrhagia. All right. So these are some of the objective ways to know that you're having menorrhagia. Or 3, your menses is longer, you're bleeding for over 7 days, you're bleeding, definitely you're having menorrhagia. So these are some of the symptoms. So it's heavy bleeding. And this is a problem because for a lot of women, they present to the hospital with anemia, all right? They have been bleeding heavily for months, for years, and they just don't want to come to the hospital. Some have been told they have fibroid, but because they are scared of being operated, they don't come. And so they bleed heavily for months, and when they come to the hospital, very, very pale, very anemic, and anemia can cause heart failure, all right? That is a big problem you don't want to get with anemia, all right? And so that's something we should be very aware of. Now, dysmenorrhea, that means very painful menses, all right? You're having your menses and you're in pain. We have what we call primary dysmenorrhea. It is normal. It is normal for a woman to have dysmenorrhea during her menses, which we call primary. But there's what we call secondary dysmenorrhea. When you have secondary dysmenorrhea, it means there is a problem. You're probably having something in your abdomen which is causing you to have the pain. Now, how do you know you have primary dysmenorrhea or secondary? Now, primary dysmenorrhea, the pain may begin with your menses or may begin just a day before your menses, a day or two before your menses, and it may last for 1 or 2 days, and then you continue bleeding. By day 2, the pain has stopped, all right, or has come down significantly, and you continue bleeding. But secondary dysmenorrhea, the pain may start with the menses, and it may last throughout the whole duration of the menses. That is what we call this secondary dysmenorrhea. That means there's a problem. That means there's a pathology. There's a problem with your pelvis, and you should see a gynecologist. All right. So that's what we call secondary dysmenorrhea. Infertility. I showed you earlier on when I was showing the picture of the womb. Sometimes the fibroid can be growing at a place where it will be blocking the passage of the sperms into the tube, all right? And so the sperms may not go into the tube to meet the egg, and then you get infertility. Recurrent miscarriage. Now, when you get pregnant, when there's fertilization, the embryo will come in and get implanted inside the womb, all right? That's where the embryo will come and get implanted. Yeah, that's the word, and grow there. But of course, if the fibroid is there, the embryo may not be able to even implant, all right? And then you have miscarriage. So sometimes a woman, you keep on getting miscarriage anytime you get pregnant, and then you get a miscarriage. You get miscarriage, all right? So these are some of the problems you can get. Now, leg swelling. Sometimes the fibroid may be so huge in the pelvis, in the lower abdomen, so blood flow back into the upper part of the body is blocked, all right? And so it causes swelling, it causes back pain, all right? And it can cause problem with urination because it may be compressing. I had a lady, I think 3 months ago, her problem was she couldn't urinate 3 times. It happened to her. She woke up in the middle of the night to try and urinate. The urine could not come, and she was in so much pain. The passage of the urine had been blocked by something, all right? And it was fibroid. She had a fibroid which was pressing onto the passage where the urine will come through. So you can imagine your bladder is full and you can't urinate because it's blocking it. Of course, some women have obvious abdominal swelling, so the woman will tell you that, doctor, there's something moving around in my abdomen. Some of them, that's what they call it. Something is moving around in my abdomen. Some will say the abdomen is swollen. Look at this picture. This is not a pregnancy, all right? This is a very huge fibroid, all right? And the woman will be walking around, people will think she's pregnant, but it is a fibroid. Okay, so this is a picture of a swelling this thing. So this is an example of an operation we did for somebody with fibroid. You can see how huge it is, all right? Very huge. They can get really, really huge. Some can get as big as a full-term pregnancy. Okay, so I've talked about this already, effect of fibroids on pregnancy, all right? Infertility, I've showed you how it causes it. It can cause a lot of miscarriages. It can cause preterm labor, all right? The baby would not get the chance to really grow. There's always the sense, so before you realize she's in labor, and there's something called placenta abruptio as well, okay? So it can have a lot of effect on pregnancy, all right? So sometimes women are pregnant and they have fibroid and they come to the hospital. Of course, at that time, there's nothing really the doctor can do. I mean, you can't operate a pregnant woman to remove a fibroid, right? We just have to manage her whenever she has any of the problems. Okay, so now how do we manage fibroid? Now this is very, very important. A lot of people come that they have huge fibroid and they say that is there medicine we can take to melt the fibroid? Is there medicine we can take to melt the fibroid? A herbalist has given me medicine to take to melt the fibroid. So I'm taking it, the fibroid will melt. Now, there's no medicine that we can take to melt fibroids. Okay, fibroids are very hard. They're as hard as stone. If they take a fibroid, let me show you this picture. Look at these fibroids. They are really hard. If they use this to hit your head, you collapse, all right? They are very, very hard. Okay, so nothing can melt. There's no medicine to melt these huge fibroids, all right? Now, the only time that gynecologists will give medicine of fibroid, sometimes the fibroid is so huge, we know operating it will be a bit difficult. So there are some drugs that we give to the woman, you know, to make it easier for the operation, to let it get demarcated well in the uterus, all right? But normally we don't even give that medication for more than 3 months, because that medication also causes the woman to have menopausal symptoms. It stops the ovaries from working, all right? Because as I said, the ovaries are producing estrogen, which feeds the fibroid, okay? So, so when we give the medication, of course, the ovaries will not produce estrogen again, and it's like the woman is at menopause, all right? So we give it for a very short period so that we can operate easily, all right? That is for huge fibroids, all right? But even as soon as you stop the medicine, the fibroid start growing rapidly again, all right? So that's absolutely really, this is the only time we give medications for it. Now, the main management is operative. Now, we would only operate on a fibroid if it is giving problems. As I said, most fibroids are asymptomatic, but I showed you earlier on all the problems that fibroids can have. So you have a fibroid, you are bleeding a lot. Of course, you get anemia and heart failure. So we have to take out the fibroid. Or you have fibroids and you're having so much pain every month during your menses. You are getting recurrent miscarriages, infertility, obviously, it's giving problems. So these are the times we operate on fibroids, okay? All right, and the operation that we do are one, myomectomy. That means we are removing only the fibroid, okay? We don't remove your womb at all. We just take out the fibroid. Now we do this for women who have reproductive wishes. They still want to get pregnant, all right? They still want to get pregnant. They still want more children, or maybe a woman who hasn't even gotten pregnant before, all right? She's a young woman. She hasn't gotten pregnant before, but she has fibroid, which is giving her a problem. So we'll take out only the fibroid, which is called myomectomy. Now, for a woman who is has completed her family, all right, she doesn't plan to give birth anymore, and or she's perimenopausal, that means almost at menopause, she's in her late 40s, right? But they will advise them on hysterectomy. In this operation, we are taking out the whole of the womb, all right? We are taking out the whole uterus away, because she doesn't need it. She's not going to use it for anything. The only function of the uterus is child birth, all right? It doesn't have any other function in life, right? It's only for childbirth. So for a woman who has completed the family, or she's perimenopausal, almost around menopause, and she doesn't intend to give birth again, we just take out the whole of the womb. Normally, we do what we call total abdominal hysterectomy. We remove the abdomen, the womb, and the cervix, as well as the ovaries, all right? As well as the ovaries, because she's almost at menopause, and very soon the ovaries will also not be needed again, all right? So why are we removing the cervix and the ovaries? Because of the probability that in future they may get cervical cancer or they may get an ovarian cancer. So if the woman will get these cancers, and the organ will no more be of importance after menopause, why do you leave it there? All right, so we just take out everything. And they are generally safe operations, all right? They are generally very safe operation. And so most women don't do the operation, they delay because they are scared of being operated. They are very, very scared. And so they don't get operated earlier, and it gets worse, all right? Generally, they are safe, so far as they are being operated by somebody you trust, experienced person. So these are a picture of a fibroid nodule, all right? Now, let me tell you, all these fibroids was removed from one uterus, okay? So sometimes a woman can have multiple fibroids, multiple, plenty, just one uterus. So all these fibroid nodules were removed, because if you leave one nodule, you just leave one small nodule like this one, it will grow again to become big, and the woman will come back again complaining, all right? So when we do the operation, sometimes it's not an easy thing, but we have to remove every little nodule, because any little one you leave, so far the woman is still in her reproductive years and she's still secreting estrogen, it will grow back again. And this is also another example. All this from one uterus, all right? All these fibroids from one uterus. Now, generally, people say, how do we prevent fibroids? So I showed you the risk factors. So if you're an African woman, Black woman, there's nothing you can do. You're already Black. So there's nothing you can do. The only risk factor that you can do something about family history, you can't change your family, all right? Let me show you the risk factors again so that we know, because we are talking about prevention. So these are risk factors. You can't prevent being Black. When your menses start, you can't do anything about it. How late your menopause is, you can't do anything about. The only thing you can do something about is high fat diet and obesity. These two things, you can eat well, avoid fat diet, because those things will make you obese, all right? And obesity would put you at risk of having fibroids. So obesity is the one thing you can take care of to help prevent fibroids, because it's a risk factor. So obviously that is the only thing. We call it what? A modifiable risk factor. It means you can do something about it. The other risk factors, they are non-modifiable. You can't do anything. You can't change your race, you can't change it. The other things, you can't change your family and stuff like that, all right? So obesity is what you can do something about to prevent it, all right? So thank you. This has been about fibroids. And then let me talk briefly about ovarian cysts. Now, this is also very, very common problem. A lot of women have problems with ovarian cysts. It's really, really very common. And a lot of women, just like fibroid, they have ovarian cyst, but they don't know that they have an ovarian cyst. Now, what is an ovarian cyst? Now, it is a fluid-filled sac. All right, it's a sac which is filled with fluid within or on the surface of the ovary. All right, so that's what we call an ovarian cyst. The ovary is normally solid. All right, it's a solid organ, the ovary. That is where is the ovary that produces the eggs every month. For the woman, it also produces hormones like estrogen and progesterone, all right? So it's solid, but sometimes you get a fluid-filled sac in it, and that is what we call ovarian cyst. Now, the thing is that most of the ovarian cysts, most of them will disappear within a few months, mostly 2 or 3 months, they have disappeared, because we call them physiological cysts. Physiology is part of your physiology. It happens normally. So within 2-3 months maximum, most of them would have disappeared. But there are some few that don't disappear, and they persist and they stay there. And they are the ones that can give problems, especially when their size is more than 5 to 8 centimeters. All right. When their size gets big, from 5 to 8 centimeters, then they can give problems. All right. But most younger women, it's always the benign cyst. And whenever we say something is benign, it means it's not a cancer, all right? It's not a cancer. Whenever a woman has ovarian cyst, that is one of the things we are worried about. That is it a cancer, especially if she's an older woman, all right? We are always worried about cancer, because ovarian cancer can be devastating. They are they spread easily, and it's nothing that we joke with, all right? So, but most of the one that younger women have is mostly the benign one of physiological cyst. It's not a cancer, but of course, we always have to be sure of what we are dealing with. Of course, that I've seen a lot of young women who have gotten ovarian cancer before, so it doesn't mean younger women can get it. Now, what are the risk factors for ovarian cyst? What are the risk factors? Now, that's fertility drugs, one, all right? A lot of women who want to get pregnant, they take fertility drugs. Now, some of the drugs, you've prescribed it for a woman before, and so when she tells her friend that, oh, Charlie, doctor gave me this drug I took and I got pregnant. So they also go to the pharmacy and buy the same drug, and then they'll keep on taking it every month. They will end up with what? Ovarian cysts, because they are stimulating the ovaries too much, all right? Mostly this fertility drug, they stimulate the ovaries, all right, to release more eggs. And so far as the ovaries is being stimulated, the chances of it forming cysts is very, very high, all right? So you do not take fertility drugs just like that. You always have to take it when it's prescribed to you by a gynecologist. There are specific ways to take it. Pregnancy also puts you at risk of ovarian cyst, all right? There are certain cysts, something we call corpus luteum cyst, which women get, some pregnant women can get, all right? When the ovary releases an egg, they leave something we call corpus luteum, which produces progesterone. Sometimes it also develops a cyst while the woman is pregnant, all right? But most of the time, by 16 weeks of pregnancy, that cyst disappears, all right? Yeah, okay. And then we have endometriosis. When a woman has endometriosis is something certain women have, where they have very painful menses, extremely painful menses, and it's associated with infertility too. They just can't get pregnant, all right? Sometimes this endometriosis affects the ovary, and it can also cause an ovarian cyst, all right? Previous ovarian cyst. So a woman who has had an ovarian cyst before is always at risk of getting another one, all right? Previous ovarian cyst. So these are the risk factors, okay? So when an older woman gets ovarian cyst, she should be thoroughly assessed to rule out cancer. Because as I said, ovarian cyst, we always have to make sure it is not a cancer, especially when the person is an older woman, all right? So we don't joke with it at all, right? So the age also matters a lot, okay? When she's older, we have a problem. When she's younger, we are not so much worried, because as I said, the younger woman is mostly what? A benign cyst. But if the woman has gotten a breast cancer before, of course, then we are more worried about cancer, because there's a big link between ovarian cancer and breast cancer, okay? But, all right, so previous history of ovarian cyst, full physical examination. We normally have to examine the woman fully to make sure that other things are not present. And there are some investigations that we have to do to make sure that this is not a cancer and this is just a normal physiological cyst, all right? So when you hear that you have an ovarian cyst, or a friend tells you they have ovarian cyst, they shouldn't just sit at home, especially when they are older, all right? They should see a gynecologist. So what are the symptoms of ovarian cyst, all right? And these are symptoms a lot of women present to the gynecologist with. Accident, we have something we call accident in ovarian cyst, all right? So you have an ovarian cyst, normally the bigger ones, it can just rupture, okay? The cyst can rupture, and then you bleed within your abdomen, okay? It's just similar to ectopic pregnancy, all right? So the cyst ruptures and you bleed. Normally the cyst may rupture after sexual intercourse, or after exercise, or maybe some trauma, all right? And you bleed. That is what kind of accident in an ovarian cyst. Or it may undergo torsion, that is twisting, all right? You know, some of them have a stalk, so they twist, and so blood doesn't go to the cyst again. And when blood is not going to the cyst, it becomes very, very painful, all right? Sorry, it's a bit dark. When blood doesn't go to the cyst, it becomes very, very painful. All right, that's so. And dyspareunia, painful sex, all right? A lot of women say, look, when I have sex with my partner, it's very, very painful, very, very painful. Most of the time it's due to ovarian cyst, all right? Because sex is never supposed to be painful, all right? So far as the woman got wet nicely, penetration should be easy and It's not supposed to be painful at all. So, and normally that pain is, they tell that they feel the pain deep inside. Okay, they feel the pain deep, 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 you know. The women understand what I'm talking about. So it could be a symptom of ovarian cyst. Lower abdominal pain, obviously, all right? Low back pain. So some women have low abdominal pain a lot. They have lower back pain, and they have abnormal bleeding or menses, all right? Abnormal bleeding, abnormal menses, because of course the ovarian cyst also producing the hormone estrogen, so it causes some hormonal imbalances, so it messes up their menstrual cycle, all right? And of course, very painful menses, especially if the cyst due to the endometriosis, all right? They have very, very extremely painful menses. Infertility as well, especially those related to endometriosis, all right? They may have infertility. And pelvic pressure, all right? There's so much pressure down there, bloating. And some can even cause constipation because they compress on the rectum, which is just all in the pelvis. Or some to urinate very frequently because I'm compressing on the bladder. There's also what we call precocious puberty and early menarche. You know, some very, very young women, girls, I said not women, girls, even before they start their menses, may have ovarian cyst, all right? And because this cyst is producing estrogen, they get into puberty very quickly, all right? That's what we call precocious puberty, all right? And then they start having their menses. Of course, bloating also because you have a mass in the abdomen. Okay, so these are the symptoms with that women typically have with ovarian cyst. So this is a picture of a normal ovary. Okay, you can see it very normal. And this is a picture of an ovary. This is the ovary. Let me outline the ovary, if you can see my cursor. Are you with me? I've not asked this question in a long time. If you are with me and you are learning something, please type value, just for me to know that people are with me. Sorry, I have not been asking. I don't know if I've been speaking to myself for the past 30 minutes. All right, beautiful, beautiful. All right, that's lovely. So I guess we are all here. So that is the normal ovary down here, and this whole thing is a cyst in a sac, all right? So there's a fluid-filled sac on the ovary. So this is just an example. And this thing can grow very huge, extremely huge. It can grow as much as 15 centimeters, 20 centimeters, 30 centimeters, very, very huge, all right? Very, very huge. Okay, so that's how it looks like, ovarian cyst. Now, these are pictures, some pictures of ovarian cyst here. All right. Now, as I said, most cysts are physiological. All right. That means it's part of the normal process. A woman ovulates. When she ovulates, the egg is released from the ovary, and there's some of the follicles which were growing don't refuse to stop growing, and they become fluid filled. All right. And so that's what we call a physiological cyst, all right? It's normal. They are just full of fluid alone, nothing is inside. But within 2 months, 3 months, it disappears, all right? That's the physiological cyst. But as I said, any cyst 5 to 8 centimeters and above always has the potential of giving what we call accident in ovarian cyst, rupture, torsion, bleeding, all right, but most of them will disappear. And some can be pathological. Those are the problematic ones. And there are ways we know when we do a scan, if this one is likely to be pathological. When you say pathological, that means we are talking about something that could be cancerous, you know. So mostly a woman may be older, but younger women too can get it. And there are certain features we see when we do the scan of the cyst that will make us know that, oh, this one may be a problematic one, all right? And we would make you do certain lab investigations, blood investigations, checking certain things like CA125 and stuff to confirm whether it is pathological or not. But mostly it is physiological, all right? So this is an example of a huge, you can see this one is very, very huge, all right? Very, very huge one. Okay, so you can see as the same person, one smaller one, and one huge one. So this one may be just like 5 cm, but this one you can imagine may be extremely big, about 20 cm. So how do we manage ovarian cyst, all right? So sometimes I get a call, oh, doc, I was told I have an ovarian cyst. What should I do? We have what we have three main ways of managing it. Watchful waiting, all right? That means we wait. We don't do anything. It's called expectant management. We don't do anything. We don't give you any drugs. We don't do any operation. We just wait and monitor it for at least 2 to 3 cycles to see if it will go down. And as I said, most of them are physiological, so they will go down on their own, okay? So we don't do anything. Watchful waiting. So far as when we do the scan, everything about the scan shows that this is likely to be physiological. The history suggests that this is likely to be a benign one. The age of the woman too, we take that into account. Very, very important, all right? And so we just wait. We just repeat the scan about after 2 months, after 3 months to see if it goes down. And I've had so many patients like that, all right? So many patients, they present ovarian cysts, they are worried, they are scared. I just tell them, look, relax, let's repeat the scan. We repeat it after 3 cycles and there's no cyst anymore, all right? All right, yeah, so that's watchful waiting. And then of course, medications. Now, medications, which we call contraceptives, the contraceptive pills, they are helpful in preventing ovarian cyst. Okay, they are helpful because remember, I told you the men's ovulating is what causes the cyst. All right, you release an egg, your ovaries is producing follicles. Some of them end up becoming cysts. All right, and because you're ovulating. Now the contraceptive pills prevent your ovaries from releasing egg, from follicles, from releasing follicles developing. All right, so the combined oral contraceptive pills mostly help in preventing it. But if you already have the ovarian cyst, the contraceptive pills do not change anything. All right, it doesn't change anything. Some think as soon as I take the contraceptive pill, the ovarian cyst will go down. No, studies have shown that whether you take pills or you don't take it, when the cyst is present, the result is basically the same. All right. Yeah, so the contraceptive pill rather prevents it, but when you already have it, it doesn't do much. You just watch for waiting. Now, surgery comes in when there's a reason to do the surgery, all right? The cyst is getting bigger, it is not getting smaller, it is giving you all these problems I mentioned, all right? You're having painful sex, lower abdominal pain, back pain, abdominal menses, painful menses, infertility. It's giving you a lot of problems, all right? We're also scared that this may be cancer. It may be a malignancy. So we want to take it out so I can take it to the lab for the pathologist to confirm that, wow, this is not cancer, all right? That is when we do surgery. So basically, huge cyst, giving problems and all that, we have to do surgery for it. Before it ruptures, you present to the emergency room or a twist, and you're not enjoying, you're not having a good sexual life because you're having pain, you're always running away from your partner or finding reasons not to have sex, or you're having back pain every day, very painful menses, and you have an ovarian cyst. There's no reason to be going through that pain every day, all right? Those are indications for surgery. And the surgery we do is mostly what we call laparotomy, remove it. In other places too, they can do laparoscopy to also remove it. Now, how do you prevent ovarian cyst? Now, maintain a healthy weight also helps. Rule out fertility medication. Don't be buying fertility medication off the counter or when you do not need it, all right? You are just worrying yourself. Stop smoking. Think birth control, because I said the birth control pills also help prevent it, okay? Schedule a gynecologist appointment, all right? Generally, most women never schedule any gynecological appointment. They may have an ovarian cyst for years and they don't even know they have an ovarian cyst, which is very, very bad, all right? Generally, a healthy lifestyle, good general well-being, all right? These are some of the ways that you can do to help prevent ovarian cysts, all right? And as you can see, the weight issue has come here again. The weight issue was in fibroid. And in fact, most gynecological problems, weight problem is always there. So I always recommend this for a lot of ladies who want to lose weight and they are not able to exercise. You tell the woman, go and exercise, she'll just laugh at you. Yesterday I had a lady, 120 kilos, very huge. She has ovarian cyst. You know that if you're going to operate a 120 kilo woman with a huge fat on the abdomen, it's not going to be an easy operation. They always will end up with wound infection because of all the fat, and you know they don't get good wound healing. All right, so I always recommend Switch. It's a very good weight loss product. All right, and it helps your body to lose weight by burning fat. Okay, most people know certain people, they can eat a lot. They eat so much, but they don't gain weight because these people have what we call a good metabolism, a good metabolic rate, or a high metabolic rate. So as soon as they eat, their body burns the fat. When they eat, their body burns the fat. So they don't gain weight. All right, now what Switch does is that it switches on your metabolic rate to a high metabolic rate, like those people. All right, so your body begins to burn fat, and that is how you generally lose weight. All right, and it's a very good product. It's helped so many ladies have put them on, and they lose weight. All right, so please, as I've talked about fibroid and ovarian cysts, you've realized how important weight loss is. All right, so Switch is a product you can get, and already, of course. Solgivity too is a product that's general well-being. Every person who is interested in their general well-being should be on. Your cells function better, your cells dividing well, because they help your cells to function better. All right, they are very good for the cells. I talked about fibroid. Your cells begin to divide abnormally and all that. So Solgivity is an antioxidant. All right, it contains a lot of very powerful antioxidants from what you can see. Ribosine, which increases your glutathione level. A lot of people now know about glutathione because of how good it is for the cells. It makes the cells function better and they heal well. Just recently, I operated on a lady, I think 2 weeks ago. The lady is on this call. Yesterday, I saw her. Her wound has healed very well. You wouldn't even notice she was operated, all right? And this is one of the products that helped her wound to heal well, because it generally helps your cells to function better, all right? Your cells function better, all right? And for the general well-being of your cells, I always recommend this product. It contains ribosine to increase your glutathione level, resveratrol, which reduces cholesterol level as well. And it also helps boost your immune system, all right? You get a very good immune system from it. And selenitonium is an anti-cancer antioxidant, all right? Help prevent cancer as well, okay? And so this is also a very good product. So Switch for the weight loss, Solgivity for the general well-being of your cells, all right? Because most of these problems I'm talking about, they start from your cells not functioning well enough, all right? So these two products, you don't easily get them in pharmacies. Whoever invited you to join this call, just contact the person that you want Switch to lose weight, or you want Solgivity for their general well-being, good immune system, cells to function better. Contact whoever sent you the link to join this call, and the person will help you get some. All right, so I'm Dr. Pakalote, obstetrician gynecologist specialist. If you want to reach me, if you have any of these problem or a gynecological problem and you want my advice, or you want to reach me, you can WhatsApp me, or you can call me, or you can send me an email on the. Thank you very much, and I'll hand over to Dr. Albert and for any questions. Thank you.
Thank you very much, Dr. Parker. It's always been a lecture. I always enjoy your presentations. That's why you are our consultant, gynecologist, obstetrician for this channel. We appreciate you so much. And I know a lot of us on this call have learned a lot, because this is a very common condition. There are a lot of myths around it. But today you heard from the expert himself. You heard him say fibroid is like stone, right? And you also helped him talk about weight, how reducing your weight to the desired levels will help prevent both ovarian cysts and the fibroid as well. Thank you very much, Dr. Parker. Now, just for 3 seconds, I just want you guys all to, just for 3 seconds, we're going to go to questions and answers. So get your questions ready, All of us on this call, after the call, the recording will be shared on my YouTube channel. So just take 3 seconds, click on the YouTube link that I've shared on the Zoom, click on it and subscribe and put the notification button on so that when we are done and you want to go and watch it again, you have access. And also when we come on live again another time next week and beyond, you will be notified. So please take 3 seconds, click on the YouTube link, go subscribe, put the notification buttons on. Now, let's get to questions and answers. Please feel free, type your question in the chat box and in the comment section. I will read it out to Dr. Parker. He will read it himself and he will answer you. So my first question I would also want to ask Dr. Parker, first of all, is, Doc, is fibroid after the operation, is it very likely that it may recur?
Okay, thank you very much. So I showed you this picture again. All these fibroids were removed from a single uterus, all right? And each of them is independent of the other, all right? Each of them has its own cell line. Most of them, the smooth muscle cells, the cells of the womb, the fibroid starts from those cells, all right? So, of course, each of them has its own cell line. So, assuming you remove all and maybe you leave some of these ones, sometimes the gynecologist may not be able to remove all. Some can be so many. And some may leave some may not see some may not feel some because they are too little, they are too small. So at the time of him removing it, there's some that were so small that he couldn't feel it. So he left it, all right? Later on, that one will come big again, all right? So fibroids can recur. Of course, it can recur. Not always, but it can recur due to the reasons I've given you. So generally, when we operate fibroids in a woman of reproductive age who hasn't completed a family or who hasn't started a family, we advise said, Madam, please go and start your family quickly or go and complete your family quickly, because we always know that there's a possibility of it recurring. Thank you.
All right, thank you very much. There are other, so in the meantime, please put your questions in the chat box and in the comment section, both YouTube and Zoom. Read out for Dr. Parker and he'll answer for us. Now, there's a question. Why is it common in blacks, Doc?
Well, so that's genetics, all right? It's got to do with genetics. Certain diseases are more common in certain races due to genes and DNA, all right? Just like sickle cell is more of something for black race. You don't get a white woman getting sickle cell disease. And they also have certain diseases that they get and we do not get it here, all right? There's a lot of diseases they also get, we don't get it. It's all got to do with our genetic makeup, all right? And there's a genetic disease for fibroid. I didn't want to go into that. There are some genes which are associated with development of fibroids. Okay, and so if you have that genes, that's why you would get fibroid. The white people do not have those genes. It's mainly blacks.
All right. Another question is, can a pregnant woman have ovarian cyst?
Yeah, I said it as I was talking. They normally have a cyst we call corpus luteum cyst, all right? The corpus luteum is what is left after ovulation. When the woman gets pregnant, the corpus luteum is what supports the pregnancy. The first half of the first 10 weeks of the pregnancy is the corpus luteum that supports the pregnancy until the placenta takes over. All right. So sometimes the corpus luteum develops a cyst, and it can be huge. It can be huge, but most often by 16 weeks, it disappeared. All right. Sometimes it can give problems during the pregnancy, but most often it disappears.
All right, so this question has been answered, but a person joined recently. So I guess for the benefit of those who join us late, a woman is asking, how would one know that she has fibroid? Briefly, how would one know that she has fibroid?
So as I said, most people with fibroid are asymptomatic, but when you have heavy menses, we call it menorrhagia. Your menses are heavy, and I explain, how do you know your menses are heavy? You're having clots in your bleeding, big clots, all right? You are bleeding for more than 7 days, all right? You are having what we call flooding. You bleed and it stains your underwear or your clothing, or you're using more than 5 pads. Within the 12 hours in the day, you've used more than 5 pads already. You know that you're having menorrhagia. Some have dysmenorrhea, that's severe menstrual pain, all right? The pain starts with the menses and it lasts throughout the whole menses, or you may even be having lower abdominal pain during any time of the month because of what we call degeneration. And some we have recurrent miscarriages because the fibroid is where the baby has to implant. Okay, the baby can implant. Infertility, sometimes the fibroid is actually blocking the passage of the sperms. All right, leg swelling, back pain. So these are some of the common symptoms that will make a woman know that she has fibroids.
All right, so another person wants to know, Doc, please, can ovarian cyst cause delay in menstruation or complete stopping of the menstruation?
Generally, the ovarian cysts, they cause abnormalities in the menstruation, abnormalities, all right? Because as I said, the cyst also produces hormones, all right? They have the granulosa cells and which produces the estrogen. So they cause a lot of hormonal imbalance. So they would normally cause abnormal menses, all right? Sometimes they are bleeding where you're not supposed to bleed and all that. That's generally what it causes, okay?
Okay. So another person want to ask, can fibroid move outside the womb if a woman gets pregnant?
Oh, the fibroid, I don't know what she means, but there are some fibroid that are on top of the womb, on the muscle, okay, outside the womb, but they are attached to it. We call it subserosal fibroid, or some we call pedunculated. They are attached by a stalk. All right. But of course, if the fibroid will not move from one position to the other. Wherever it is, where it starts, is always going to be there. Okay.
All right. If you have any question, please feel free, put in the chat box in the comment section, and Dr. Parker will gladly answer you. Put your questions in the comment section and in the chat box. Dr. Parker will gladly answer you. Someone is asking, I did fibroid surgery about 3 years ago, and recently I did a scan and was told I have an ovarian cyst. What should I do?
Yeah, so as I said, you should see a gynecologist, all right? As I said, most of the ovarian cysts are physiological, but it depends on what they see on the scan, what they actually reported on the scan, your age, the problems is given, all right? There's so many things, and I explained them already. So you should see a gynecologist and you should be monitored, all right? Yeah.
Yes, sir. If you just join us, please feel free. The recording will be posted on the YouTube channel, so you will have access to replay so that you understand everything, so that we don't have to repeat for those of us who join on time. Can a woman who has fibroid get pregnant?
Yeah, a woman who has fibroid can get pregnant. A lot of women, we sometimes even diagnose the fibroid whilst they are pregnant and we do the scan. And then that's when we see. And she can carry the pregnancy normally to term, but it depends on the size of the fibroid and where the fibroid is located. Now, if a woman is pregnant and then she has fibroid, this is the womb. I showed you the picture of the womb. So if a fibroid is somewhere here, you can see this fibroid that my cursor is pointing at. Huge fibroid. This woman cannot deliver on her own because the fibroid is where? Just close to the cervix or the lower, this is lower segment of the uterus, all right? So there is no way the baby can pass here. It's impossible. So this woman will have to have a cesarean section. That's one problem with fibroid in pregnancy. You are likely to have an operative delivery. Now, even if you're able to deliver on your own because the fibroid is at the top here or somewhere, you may bleed a lot after delivery. We call it PPH, all right? So if the fibroid is huge, the gynecologist may always advise on the operative delivery, or you shouldn't deliver at a clinic or a place where they are just midwife. Deliver in a hospital where they have theater. In case you are bleeding a lot, they can operate you. So if you have fibroids and you're pregnant, you have to deliver in a hospital with a theater where you can be operated, and don't know that you're at risk of having operative delivery. And you may also have a lot of pain during the pregnancy because the baby and the fibroid will be competing for blood. All right, so the fibroid undergoes what we call degeneration because it's not getting enough blood. So the woman will have a lot of pain throughout the pregnancy. Of course, there are some that do not have any problems at all and everything goes on well.
All right, Doc. There is a very popular myth which we need you to help us correct. Somebody is asking that question. He said, can less menstrual flow lead to fibroid? When your menses, the flow is small, can it lead to fibroid?
So these are the risk factors of fibroid, all right? There's nothing related to when your menses is small. That myth is that the person didn't put it well. They think that the fibroid is formed by blood, all right? So they think if you are not menstruating, the blood is kept in your womb, and then the blood that becomes the fibroid. That is very wrong. Fibroid has got nothing to do with blood. Fibroid is formed from the smooth muscles of the uterus, which are dividing abnormally. All right. I had this first thing some years ago when a lady was going on a honeymoon and she realized that she'd be having a menses during her honeymoon. So I told her that I can prescribe a medicine for her so that she won't bleed, she won't have a menses during her honeymoon. And she said, hey, if she doesn't have a menses, the blood will turn into fibroid. All right. And that's when, and this is a very educated woman. All right. So blood is not what causes fibroid. All right.
Thank you very much for correcting and educating us. Fibroid is not from blood or any blood accumulated anywhere. It's from the smooth muscle of, so it's from the womb. It's from the smooth muscle, not from any accumulated blood. Now, another question is, when a woman has fibroid and she's delivering operatively, can the fibroid be delivered along with it?
No. A fibroid don't come out like the way a baby is coming out. Fibroids are operated. All right, fibroids are operated. And so a fibroid, when you say delivered, I don't mean whether you make the fibroid be operated at the same time. You know, there are some gynecologists who will not touch a fibroid during a cesarean section because they believe at that time the uterus, a lot of blood is coming to the uterus, so they don't want to touch the fibroid in case the woman bleeds a lot and then the operation becomes prolonged and difficult. But there are some other gynecologists who would do a fibroid operation during the cesarean section. But majority will do just the cesarean section and they'll tell you to go and come back in 6 months' time for the fibroid operation. So it depends on the gynecologist handling you.
Okay, so taking the same question in a different light, just so I get Eric's question fully answered. What if he meant that can a woman who is delivering normally, vaginally, deliver the fibroid as well? Maybe that's what he wants to know.
No. Fibroids are attached to the uterus. They are attached, so it can't come out. They have to be operated. All
right. Thank you very much. Okay. Anybody else has any question? Please put in the chat box in the comment section. Dr. Parker will gladly take it for us. If you join us late, feel free. We're going to leave the recording on the YouTube channel, so feel free to just hold on. You have access to have the playback, to have access to the video. Because Dr. Parker gave us a full lecture on all these things. You need to hear everything for yourself and share with your friends. Any question, please feel free, put in the chat box. Okay, Eric is also asking, can increased glutathione levels reduce the risk of fibroid?
So as I said, as glutathione helps the cells to function better, all right? And when the cells are functioning better, they do what they are supposed to do. And that's the general well-being of the cell. When things are not functioning better, cells can divide abnormally, they can start doing things that they are not supposed to do. So most doctors, we are now talking more about what we call molecular medicine, cellular medicine. We realize that if you treat the cells well and the cells are healthier, they will function better and the body in general would have a very, a good well-being, a better well-being. So there's no harm in improving your glutathione level to help your cells to function better.
All right. Thank you very much. Thank you. Okay, somebody's asking, what is degeneration of fibroids? The person heard you say it.
So that is when the fibroid is not getting, the number of degeneration that fibroids go through. I don't want to bore. We have red degeneration, cystic degeneration, fatty degeneration, calcific change, sarcomatous change. These are all changes that fibroids can undergo. And most of these changes are associated with pain. That's why women have fibroid and they get pain, lower abdominal pain. Now, the common one is the red degeneration, where the fibroid is not getting enough blood. Sometimes the fibroid is so fast growing, it's growing too quickly, it outstrips its blood supply. It's growing faster than the blood vessels are forming to supply it with blood, all right? And so it undergoes what we call red degeneration because it becomes ischemic. Ischemic in medicine means a part of the body is not getting enough blood, so it begins to be painful. It also happens when the woman is pregnant and the more blood is being diverted to the baby, so the fibroid is not getting enough blood, and it undergoes degeneration, which we call red degeneration. When you operate a fibroid which has undergone degeneration, it is softer, all right? It feels very soft. The normal fibroid is very hard, but a degenerated fibroid is cystic, it's softer, and it has a lot of pain. It causes a lot of pain. Yeah, so.
All right. Somebody is asking, okay, can fibroid lead to death?
Can fibroids lead to death? Well, the problem that fibroids can give is anemia, all right? So the patient bleed, and I used to see those things a lot. These days, I think women are doing better, but women will go and sit with the herbalist for years and thinking that they will get better, and then they bleed, they keep on bleeding, they keep on bleeding. By the time they come, they are anemic. You know, the menorrhagia, that's heavy menses, causes anemia, all right? And when that happens, anemia leads to what? Heart failure, all right? Because their blood, they are not getting enough blood, so they eventually end with heart failure. So indirectly, of course, the heart failure would always kill them. So that can be the indirect relationship of death with fibroids, all right? The bleeding is a big issue that has to be handled well. And the problem is most people go to the herbalist, they take herbal medication, and they come out with heart failure. And when you have heart failure, no doctor will take you to theater and go and operate on you, because no doctor wants you to die in theater on him on the table. So the heart failure has to be treated before we can even operate you.
All right, Doc, I'm told during the presentation, you mentioned about age range for younger people and elderly people. Somebody wants to know again, the age range.
Okay, with ovarian cyst, I mean, normally when we say older woman, we normally are talking about perimenopausal, a woman who is around menopause, all right, or has hit menopause, or is postmenopausal, all right? So any woman around menopause, has hit menopause or after menopause, those are what in this case we call an older woman. Unlike women in the reproductive age, women who are still menstruating, they're still capable of getting pregnant, they are the younger women. So when we talk about the age range, this is what we mean. So when a woman in the perimenopausal range gets an ovarian cyst, or we see an ovarian mass when we do a scan, it's always worrisome because of her age, all right? We have to investigate thoroughly. Unlike maybe a 24-year-old, 22-year-old girl who has ovarian cyst, who will not bother so much compared to a 47-year-old woman or a 45-year-old woman with an ovarian cyst.
All right, all right. Thank you very much, Dr. Parker. We have a few seconds more. If you have any question, please feel free. This is free consultation. If you want to see a gynecologist or any specialist, you have to pay money. But this is free consultation. Dr. Parker, I have a question. You made mention of one of your patients that you had an operation on 2 weeks ago. And you said you gave the person something that helped with faster wound recovery. Can you go over that with us?
Oh yeah, when I was talking about cellgivity, I said it helps the cells to function better. All right, the cells generally function better. And yeah, so it helps with wound healing, all right? So, all right, you realize that when you operate women, it takes time for the wound to heal and it doesn't heal well, but all right, the wound healed very well. Within 2 weeks, she came for review. Her wound has healed very well. She's healthy looking. I didn't give her the pressure. It's something she takes already, all right? And it helped her a lot. And so I always recommend it because it helped the cells to function well, all right? It helped the cells to function well. And wound healing is all about cells functioning well for it to heal well, okay? And you see better wound healing with people who use it, yeah.
All right, Dr. Parker, as an expert, this is from me. What do you have to tell women in general when they are told they have fibroid? Most of them are afraid of operation. Please, what do you have to tell such women?
All right, so it's understandable to be scared of operation. All right, I understand it's not easy. But you know, most of the fibroid operation are relatively not a complicated operation, nothing to worry so much about. They are not with high risk, all right, so far as the woman is herself healthy, all right, very healthy woman, not anemic, all right. It's relatively a safe operation, because if a doctor has told you that you need an operation, trust me, it means you need it, all right. It means you're having problems with the fibroid. Either you are bleeding a lot, or you're having a lot of pain. It's reducing your quality of life. And how long do you want to be going through pain every month and bleeding heavily every month? You know, your quality of life is reduced. You can't function better. All right. So when they say you need an operation, trust me, it means you need an operation. The problem is you'd wait, and you would always come back for the operation. And you know, when it's later, the fibroid has become so huge, it becomes more complicated. That is when there are problems. Instead of giving, normally, look, when we are operating a fibroid, we give what we call a low incision, all right? The skin cut is low. That's after some time, nobody would even know that you've been operated. It's a low cut. But when you wait and the fibroid becomes so huge, now we have to make a bigger cut on the top of the abdomen from your umbilicus downwards, all right? And nobody would like that kind of scar, all right? But it's always because maybe you sat at home and waited for a longer time before you came to the hospital, all right? The operation becomes longer because the fibroids are bigger, or there are so many, you get it? So it always makes it difficult. But so as soon as you are seen and you realize that, look, you did an operation, come and do it. And especially when you're a young woman too, you haven't started your family, and you have huge fibroid, it's going to worry you later in life. When you get married, pregnancy is going to be difficult, all right? Or when you even get pregnant with that huge fibroid, you may even end up with the operation again when you are delivering. And so the operation you are trying to avoid, you end up having it at the time that you wouldn't even want to have it, all right? So when the doctor tells you you need an operation, please, as much as possible, do it. If you are not convinced, you're always free to seek a second opinion. If you are not convinced about what the doctor is saying, you are always free to seek a second opinion from another gynecologist. And then there's nothing wrong with that. And then have what is best for you then.
All right, thank you very much. So yes, the advice, Dr. Parker has said it. If the doctor says you need an operation, please, you need an operation. It's advisable. You can take a product that can help quicker wound recovery, like he's recommending, that's LGBT, and other ones that will help with wound recovery. Dr. Parker, there are two more questions. First one is, after a fibroid surgery, how long should you wait before you get pregnant?
Yeah, actually, we want you to get pregnant very quickly. All right, we want you to get pregnant within the year. All right, you don't have to wait. If you get pregnant after 3 months, as soon as you can start having sex, please start having sex and get pregnant. All right, of course, the first 3 months, because of pain and the wound, you can't have sex. All right, so yeah, but from 3 months, 4 months, start having sex, get pregnant. We want you to get pregnant as quick as possible. We are happier if you get pregnant within the year we did the surgery. Even if it's 6, 9 months, even happier. So you don't need to go and wait for 2 years or 1 year. Their chances of getting pregnant are higher if it is earlier. That is the thing.
All right. There's another question. Doc, when you've had a partial hysterectomy, that is, they've taken the cervix and the cervix and ovaries are not removed, can you have another surgery to remove them? And secondly, are you prone to developing ovarian cysts?
Yeah, so when you've had what we call it, it's subtotal hysterectomy. It means the cervix is left out. Of course, as for the oophorectomy, that's removal of the ovaries. You can always have an operation to remove them if there's a high chance that you may have ovarian cancer. All right, we call it prophylactic oophorectomy. That's if there's always a high chance that you're at risk of getting ovarian cancer. All right. We don't routinely just go and do an operation to remove the cervix unless there's an indication for it. And normally when we are removing the cervix, we remove it together with the womb. But there's not, we have to have a real indication to just go and do an operation to just take out just the cervix. All right.
All right. So somebody's asking a question. At the stage where the legs are swollen, what can one do to take care of it?
Yeah, you need to take out the problem is the fibroid is compressing on the blood vessels and the lymphatics. You see, when blood goes to your legs, they have to come back to your heart. All right. Now the fibroids are sitting on the pelvis and the blood, the vessels are compressed. So the blood cannot flow back to your heart. And that is what causes the swelling. So you have to cause what is blocking the vessels from bringing the blood back for the leg swelling to stop. Otherwise, it will never stop. All right. And so you have to have the surgery.
Thank you very much, Dr. Parker. I have a final question, just because of what I hear from people. People mostly in the hinterlands, in the villages, mostly will say the fibroid is because somebody spiritually has placed somebody in their womb or in their abdomen. Just as your final words, what will you say to such people? Some pastors may say somebody has placed something in your womb, they're going to pray for it to vanish and all that.
Yesterday, I heard on the news about a lady, I think she has 5 children. She was diagnosed of HIV. She started medication and she was doing well. And then she went to church and the pastors told her that she's been cured of the HIV. They prayed for her. She doesn't have HIV anymore. She shouldn't take the medicine anymore. So she stopped. And the woman died, eventually leaving all her 5 children away. All right. Please, when pastors tell you something, always go back to the doctor to confirm it. All right. Go back to the doctor to confirm it. Don't just take it. I mean, miracles do happen. We are all Christians. We believe, but God too gave the doctors the knowledge and the wisdom to also act and do what they are doing. So there are some apostles who are also medics as well. All right. So God gave us the wisdom. So always go and confirm with the doctor to make sure what they are saying is true. Fibroid is not as a result of witchcraft. All right, it's purely medical. There's no witchcraft to do with fibroid. There's nothing got to do with witchcraft. All right, it's purely medical. So please, the best people to solve this are the doctors. All right, so see a doctor, see a gynecologist when you have these issues, and let him have the final say of what you have to do.
All right, thank you very much, Dr. Parker. And for our friends who just joined us, and for those of us who may not be aware of this, we always leave the recording on my YouTube channel. So if you have not subscribed yet, take 3 seconds, click on the link and subscribe to the YouTube channel and click on the notification button. So now when we are live every week, you get notified. Thank you very much, Dr. Parker. We appreciate your time spent educating us on this very important topic. I have enjoyed the presentation. And if you are on the call on YouTube or on Zoom, and you've also enjoyed it, please help me together say thank you to Dr. Parker, our consultant gynecologist for such a selfless dedication to educate us, give us expert knowledge. Please help me say thank you to Dr. Parker for such a yeoman's job. We appreciate you, Senior. Well done. Your presentations are always rich and very, very educative. Thank you very much, every single one of you. I appreciate you for taking time off your busy schedules and joining us. This is the Weekend Health Talk. It's a weekly program that I host. The aim is to reduce the level of misinformation, especially on social media. I host different specialists from different medical fields. Last week we had cardiologists. The week before that we had another specialist. All the recordings are left on the channel. So feel free to subscribe and share with your friends. You know, friends who may benefit from this, but because they are busy, they may not have joined us live. Share with them and get them to subscribe, put in the notification button on so that they can also benefit whilst they're in the comfort of their homes or wherever they are. Thank you very much. We appreciate your support. Thank you very much. Thank you very much. Thank you very much. So again, if you want to get the full lecture and other ones that Dr. Parker and myself have done already, subscribe to the YouTube channel, share the link with your friends to do the same, share the recording with them as well. And once again, it's been a pleasing pleasure serving you all. Let us all enjoy our evening, morning, afternoon, wherever you are, whenever you are reaching out to me. Thank you very much once again, Dr. Parker, and every one of you.